the increase in population of persons, the older generation, this becomes an everyday occurrence sometimes. Dealing with people with early onset dementia or Alzheimer's is something that we have to deal with, not just with the person themselves, but with the family as well.
M4A was able to get a midi seed grant for $10,000 through another area agency on aging through what we call Dementia-Friendly Alabama. And that really enabled us to partner with the Shelby County Sheriff's Department. We joined in on what they call their CRT, or Crisis Response Training, which is a 40-hour block for a week for their officers as well as the deputies to go through different types of training, whether it be individuals with autism, whether it be fraud, whether it be dementia. So we were able to partner with them on that to really try to kind of do the beginning stages of what we now know as our dementia-friendly training. It kind of started out as a basic mechanism of review over what dementia is, kind of broad terms, and how to interact. Since then, we've adjusted it a bit to try and fit the group of individuals that we're training. How does this apply to their job? What mechanisms can they use to maybe change the situation that they encounter?
And, we were very fortunate to get the opportunity to get the training in how to deal with dementia individuals as well as Alzheimer individuals. But Shelby County, we have always tried to stay ahead of the learning curve, and any new project or new training that can come about that make us more qualified to deal with the citizens of Shelby County, we are all for it.
Well, upon completion of our training, each department is awarded a certificate of certification for Dementia-Friendly Community or department. And what that does is it really showcases that they've really taken that initiative and that effort in order to create a community, do their part in creating a community that is more welcoming to those living with dementia. Oftentimes caregivers and those living with dementia are really, they're really faced with challenges of feeling neglected, feeling like they live, kind of on their own. They're not really able to interact with other community members because of their circumstances, but having a department that has showcased and their willingness to be able to take it upon themselves to get that extra training to be a more dementia-friendly community really says a lot about those departments, that they're trying to create not really a community for someone but for everyone. So that's really been a great initiative that we like to partner and help supply certificates, posters. Sometimes we do some decals for the squad cars. So that's been a really important factor for us.
Used our training facility the first time out, and we had several people that were able to receive that training. As a result, we saw how important that training would be to us, and we have since worked with the probate judge's office, M4A, to put together a team of instructors so that we can conduct that training as often as we need to not only train Shelby County Sheriff's Office, but the municipal police officers in Shelby County. Partnering with any kind of service organization that offers some benefit to the citizens of Shelby County is very important. The red envelope or red pouch or project, I think, it kind of follows efforts that have been made in the past to inform first responders of the medication people take, a medical condition they may have, something so we can help them in the event we come across them. I am very happy to continue to partner with M4A on this in Shelby County. I think it's a very worthwhile program. I think possibly it could save lives. And with the ever-growing, what I refer to as a lot, accidental overdoses that we have, where people take too much of their prescribed medication accidentally, this can be very vital to their recovery.
The red file, it actually goes on your refrigerator. It's got 2 magnets on the back of it, and you can actually, of course, you can take it off and take it to the doctor to make sure that it's kept up to date. But its primary purpose is to be on the refrigerator in a common area where first responders could look to go, or would go to look in a chaotic situation where the individual or the caregiver or any family member might not be able to have a recollection of all the prescription drugs they're taking, their emergency contact, the allergies. So it's really a lifeline in a crisis type situation that has allowed us to, not necessarily spend a ton of money on it, but to make a huge impact for our community. Like I said, we've distributed over 10,000 and growing in less than 2 years in our 5-county region in central Alabama. So that is definitely an opportunity for every agency to be able to do and make a huge impact in their communities.
Well, I would encourage every law enforcement agency to, if that training becomes available in their area, to definitely seek it. If not, look for a train the trainer so that you can get a trainer in your agency to come back and teach your men and women. I understand that not every law enforcement agency has the resources Shelby County Sheriff's Office does, and anything we can do to assist that agency, we will be happy to. We host it periodically, and we would be happy to help them in any way we can.
Our name is the Middle Alabama Area Agency on Aging, but it's a little bit easier for us to go by our shortened name, our abbreviated name, M4A. And we are one of 13 area agencies on aging across the state of Alabama that receives federal, state, and some local funding to offer typically the same core programs, whether that be prescription drug assistance, caregiver assistance, long-term care assistance, basic homemaker assistance, homebound meals. So we have the same core program. Some of our agencies are able to, capture local funds to do programs like wheelchair assistance, installation for a ramp, grab bars, yard cleanup. There are some programs depending on the area that you're in that might have some funding available for that. So we have a lot of different programs that we offer, a lot of the same core programs, and we really want to be that. We're what we refer to as the best kept secret. We're that location where if you run out of options and you don't really know where to turn, we're a good starting point. Because not only are we an avenue for services, we're a resource center for services that are available in the community, and we have a group of representatives here that will screen each of the callers to see what services might be available, and that could really be the difference between them, receiving a meal that night. That could be the difference between them taking, important medications that could, maintain their health and safety in their home. So we try to be a starting point for a lot of people, and we hope that you can do the same in your areas, because there is an area agency in aging that covers really every town in America, and that seems to be something that a lot of people don't know about, that we can hope to get the word out about that.